Governor Abbott says it's time to reopen Texas.
All businesses of any type are allowed to open 100%. Also, I am ending the statewide mask mandate.
He says the state is ready to back off restrictions meant to slow the spread of COVID, why he left some medical advisors out of the decision. Rules to ensure health and safety waived inside hundreds of Texas nursing homes during the pandemic. We investigate why that hasn't stopped the flow of federal funding. Resignations and terminations, the new developments in the push for accountability after the winter storm crisis. Hello, and thank you for joining us for this special edition of State of Texas. I'm Josh Hinkle, and this week we're joining you once again from the state capitol. But the big story this week happened far away from Austin. Governor Greg Abbott went to Lubbock to announce the end of the statewide mask mandate. He also said that any business in the state can open at 100% capacity if they choose. The orders take effect on Wednesday. Governor Abbott touted improved COVID-19 hospitalization numbers and advancements in vaccines as reasons for lifting the restrictions, but our Wes Rapaport learned Abbott did not consult all of his medical advisors before making those decisions.
It is clear from the recoveries, from the vaccinations, from the reduced hospitalizations, and from the safe practices that Texans are using that state mandates are no longer needed.
In his plan to rescind pandemic policies, Governor Greg Abbott consulted with his special advisor, Dr. John Zerwas, a lawmaker turned University of Texas system administrator who he's called on for input throughout the pandemic.
In my conversations with the governor, I said, I don't think it's a mandate from the state that is keeping people wearing masks and keeping people away from each other and keeping people washing their hands.
But as for the other three chief medical advisors on the governor's strike force to open Texas, Dr. Parker Hudson with Dell Medical School at UT Austin said he was not involved in this decision. Dr. Mark McClellan, an infectious disease expert at Duke, said it's not the right time to lift restrictions. Noting the progress, he said it's too soon for full reopening and to stop masking up. And the Texas Department of State Health Services Commissioner, Dr. John Hellerstedt, testified to lawmakers he spoke with Abbott's team prior to the announcement, but did not speak with the governor directly.
Both the governor and I are on the same page.
Hellerstedt still encourages mask wearing and emphasized the personal hygiene practices as the best way to slow the spread of the coronavirus. We reached out to the governor's office for a response. His press secretary tells me the governor regularly speaks with Dr. Hellerstedt, Dr. Zerwas, and other members of the medical community. Her statement went on to say removing state mandates don't end personal responsibility when it comes to caring for family, friends, and the community. Basically, Josh, the governor says it's still good medical advice to wear a mask. He's just not going to make it mandatory.
So the governor has been speaking with medical advisors, but you also learned that his COVID strike team is actually not doing that much these days.
Yeah, I'm told the strike force to open Texas disbanded months ago. I've also learned that the last formal meeting of those members of that team was in the summer at least.
So the governor's order also will clearly have an impact here at the Capitol. What's that going to be like?
Well, we know there will be some changes to signage, especially with masks being encouraged but not required. But I also had the chance to catch up with Texas House Speaker Dade Phelan about the relationship between the public interacting with lawmakers throughout the legislative process.
We've been very mindful in the House to try to be as open and transparent as possible with the public. We don't want to decide and vote on bills that impact 29 million people without hearing from 29 million people who have to live underneath those laws.
So individual offices will have their own protocols they can follow, Josh, but as far as the House chamber rules, all of the members will have to vote on anything that changes there.
All right, thank you very much, Wes. The governor cited availability of vaccines as one reason for ending the mask mandate, but Texas is near the bottom in the country when it comes to vaccinations per capita. The Department of State Health Services says it's working with federal leaders to get more supply, but they say the CDC is making decisions based on numbers that undercount our state's vulnerable population.
The CDC is using older data that has us with a lower adult population than what is currently estimated now. And so we have shared that information. They have heard us. We have yet to actually see them make a change from using 2018 to 2019 census data.
DSHS says more than 1 million doses of the COVID vaccine will arrive in Texas in the coming week. That includes 220,000 doses of the new Johnson & Johnson vaccine. State Bureau reporter Maggie Glynn joins us now. So now the state has opened up the vaccine eligibility to teachers and daycare workers. Who's next?
Right, well, DSHS actually acknowledged this week that because we've already opened up more eligibility to these teachers and these childcare workers, that's actually going to be cutting into when they'll be releasing the 1C priority group. So we're not going to be hearing who is in that 1C group until closer to the end of this month. They say that they already know who that is, but they're not ready to release those details until a few weeks later.
The governor also mentioned that one of the reasons behind lifting the mask order is because of there being therapeutic options out there. What's he referring to?
Right, so he's referring to treatments like Regeneron, which actually is one of the trials for Regeneron is based up in Amarillo at Texas Tech University Health Sciences Center, where Texas Tech physicians are actually moving officially into the next phase as of this week. And that's because the trial is now successfully approved by the Independent Data Monitoring Committee, which says that Regeneron has proven enough efficacy in helping patients survive their infection without requiring hospital care. And Josh, the independent researchers say that this new Regeneron is also effective in neutralizing the new variants of COVID, which is a big deal because those variants are becoming increasingly common.
Encouraging news. Thank you, Maggie. Texas has pushed to expand business capacity before, only to back off when cases rose. You may remember back in May, the governor allowed bars and gyms to reopen while also expanding capacity at restaurants and other businesses. Less than 2 weeks later, he further expanded restaurant and business capacity, but by the end of June, he had to scale back amid a sharp increase in COVID cases and hospitalizations. In July, the governor issued the statewide order requiring face masks in most counties. But for many Texans, the need to lift restrictions to help the economy outweighs the importance of controlling the virus. Polling from the Texas Politics Project shows an almost even split when asking voters what's more important. 47% said controlling the virus, 43% said helping the economy. But there's a big divide based on politics. 82% of Democrats said controlling the virus is more important. 72% of Republicans put the priority on helping the economy. That kind of divide helps explain the rising popularity of Republicans like Florida Governor Ron DeSantis. His rejection of most COVID restrictions has earned him nationwide attention and is fueling chatter about a presidential bid. Some Texas Democrats are criticizing Governor Abbott, saying he's also trying to get national attention from conservatives.
All I can assume is that this is an effort to win over far-right Republican primary voters, whether it's in the gubernatorial re-election race that he's about to face or in the 2024 presidential primary, which reports indicate that Governor Abbott has an interest in running for president. And I understand that political ambition. I'm a politician too. I've got my own ambitions, but this is an awfully high price to pay for someone's political ambitions in a campaign cycle. I hope that isn't the reason Governor Abbott is doing this, but the rush to be the first state to lift their mask mandate, to be the first state to open 100%, feels to me like it's less motivated by public health and by science and more motivated on grabbing headlines and attention.
Abbott supporters say this is about more than politics. They say lifting restrictions is about helping people hurt most by the pandemic.
We need to look at this as not just being a one-dimensional issue. We need to think about the victims of domestic violence that have been cooped up with their abuser, with the suicides that have taken place, the children that have fallen farther and farther behind. This is not just a one-dimensional problem. We need to look at the whole thing. And I think Governor Abbott in the state of Texas, I'm proud of the work we've done.
Senator Cornyn went on to say getting more vaccines to the people who need it will be key to defeating the virus. The reckoning continues from the winter storm crisis, the new resignations and new questions after the latest hearings at the Capitol.
In the midst of a pandemic, in the midst of an emergency, you need more of this accountability, not less.
Millions funneled to Texas nursing homes where certain quality of care, health, and safety rules have been waived during the pandemic. Why our investigation is prompting action in Washington.